Ethiopia is at a crossroads. One of Africa's poorest nations, its rapid population growth now threatens to outrun the nation's slender gains in economic development. Population here grows at about 1,700,000 people every year, an annual rate of 3%. Ethiopia, which was ravaged by famine in the 1980s, has seen some increases in agricultural production, but economists warn that food supply may not be growing at a rate that will keep up with population. Ethiopia has had modest success in lowering its urban birth rate, which still remains among the highest anywhere. But the birth rate in parts of rural Ethiopia is the highest in the world, with the average woman bearing 8 children. Ethiopian officials have a simple concern. They don't want to bring children into a world where they do not have a chance for a decent life. Ethiopian children born today have only a 25% chance that they will ever attend school, a 30% chance that they will receive medical care at some point during their life. And 3/4 of Ethiopian children born today do not have access to clean water. The per capita income here of about $120 per year is the world's lowest. The country spends just $1.20 per year per person on health care, including family planning services, well below the sub-Saharan Africa average of $14 per person. In the little city of Nazareth in the Oromia region, Harguwoin sells bits of wood and animal dung for fuel. She has 6 children, the youngest just 2 years old. She is herself one of 10 siblings. She does not know her age. She recently sought contraceptives from a government clinic. But 60% of the women who want family planning services never receive any help. And the unmet need is so great that the country's population goals could be met if contraception were made available to all who want it. Ethiopia lags the world in delivery of reproductive services to women. Only 4% of women have contraception available. By contrast, family planning is available to 41% of women in India. Now, both government and international agencies are altering their strategy, bringing services to people where they live. 85% of Ethiopia's population is rural. Aster Tedesse lives in a village in Oromia province, 4 miles from the nearest road. She works with the non-government agency Family Guidance Association of Ethiopia to introduce family planning to villages in a 6-mile radius. Aster makes house calls on women who may have little understanding of anatomy or contraception. And she says it often requires repeated visits to convey a basic understanding of family planning.
For those who were not able to follow me, I keep up the contact with them, and I also mobilize the support of other colleagues to help me explain it better.
Aster gets 75 birr, that's about $10, as salary every month. In 2 years, she has signed up 99 women for contraceptives. Officials say that 6,000 women have been added to family planning roles in her county since the program began 2 years ago.
Good.
In Ethiopia, only a small minority of women give birth in hospitals.
Yes, pet.
90% of babies are born at home. And only 30% of women get any medical care while pregnant, the lowest percentage in Africa. In this teaching hospital in the capital, Addis Ababa, a European woman instructs students who will become midwives in rural Ethiopia.
Oh, come on. I thought. Oh, this is too much. Huh?
But the women in this Addis Ababa maternity ward are the lucky ones. For every 1,000 births in Ethiopia, 14 women die. This woman, whose name is Mizane, just delivered her 9th child. She is 25 years old. It was a difficult birth by cesarean, and Mizane agreed to be sterilized during the delivery. She had no previous access to family planning services. The woman says she agreed to sterilization because she and her husband, a poor farmer, simply can't feed any more children. Ethiopia may face a new population explosion. About 52% of the population is now 15 or younger, which means millions are poised to enter their reproductive years. The average marriage age here is 15. Because pregnancy carries sharply higher risk for teenagers, there is an effort to get family planning information to young Ethiopians. But only 20% of school-aged children are actually enrolled in the nation's already overburdened schools. On this day, an estimated 4,657 babies were born in Ethiopia. One, a boy born in Addis Ababa, was named Warku. In this country, with the world's highest infant mortality, his chances of dying during his first year are about 1 in 8. In the same hospital, just 2 women received Norplant contraceptive implants that will prevent pregnancy for 5 years. And in rural Oromia province, Aster Tedesse continued her search for women who want family planning. In Addis Ababa, I'm Jim Compton reporting.